Welcome to our webcast, Improving Health Equity, Resources and Solutions, dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis. Joining me today is Dr. Jan Altman, who will discuss the anti-racism module funded by a generous grant from the Josiah Macy Jr. Foundation. Jan wrote the section of the module titled Microaggressions. Jan is an educational developer and consultant specializing in diversity, equity, inclusion, and belonging education, training, and program development. Currently, she serves as a consultant to Virginia Commonwealth University Division of Inclusive Excellence faculty affiliate in the VCU School of Education and is a psychologist in private practice. She led VCU in the development and implementation of DEI education for 7 years. In 2019, she launched I Excel Education, a new initiative at VCU offering over 25 DEI courses. In 2016, she directed a large train-the-trainer program, Building Inclusive Communities, to train and certify a team of 25 diversity workshop facilitators. Together, they helped build diversity and inclusion skills among VCU faculty, staff, and students. Welcome, Jan.
Thank you so much, Barbara. It's nice to talk with you.
Yeah, I'm so glad that you're here, and you've written such an important module on microaggressions. So let me start first with, how did you get involved with the Josiah Macy Jr. Foundation grant to create the anti-racism module?
Well, that was a great opportunity, and I'm so pleased that I got to know about it and be involved. And I was working at VCU in the jobs that you were talking about in that role, and Dr. Camille Burnett is a co-PI, I think, is that right, of the grant, and she came to work at VCU and was my supervisor. And she invited me early on when we got together to take a look at what you were doing and to ask if I would be interested in contributing to writing the module. Now, this was the later stage of the grant. You know, there was a lot of planning and setting up and things that I was not a part of beforehand. So it was just this later stage of actually writing the materials that make up the teaching module. And I also got to participate in meetings with folks about how to develop those topics and make it a coherent whole. And that was a really interesting process where we got to really think hard about what would come across well and how to do this and how long it should be, and all the nitty-gritty topics of putting something this massive together. And we knew that it had the potential to make a great impact. And so we wanted to be careful about how it was designed and how it came across. I feel like it was a great honor to be asked and to be included in this effort. It was really exciting to me because this is my passion. And the chance to make a contribution on a wider scale was very meaningful to me.
Oh, thank you so much for volunteering to do this work. So Camille Burnett was a PI, as you mentioned, and she headed the content group of the module, and that was writing the content. And then there were 4 other groups as well. There was a curriculum development group, and also faculty development, and an assessment group as well. So the content group actually met for quite a while. I'd say we had a few meetings to talk about what should the content be in such a massive module, as you said. And we came up with 18 different topics that we thought deserved to be covered in an anti-racism module. And one of those was microaggressions. Why did you decide to write the section on microaggressions?
Well, first of all, I think that everyone working in healthcare can make a real difference. Even patients can make a difference. And it's in how we interact with people. What I'd learned in my role at VCU, starting out as a psychologist, I learned a lot about diversity and inclusion, and I care very much how people are treated and how they interact with each other. So that's sort of my baseline. So I was naturally attracted to the topic of microaggressions, and I'd actually already been teaching this topic in my role as the director of diversity education. And I think that microaggressions is a great topic because it is a really good entry point into learning about diversity and learning about ourselves. And I'm a lifelong learner. I really think we all are. We're all learning every day, whether we try to or not. Um, so I think learning empowers people, and I want us to improve as individuals, as groups, as a culture. So, yeah, it's a really important topic.
Mhm. So how did you research this section, or didn't you need to because you were already teaching it?
Yeah, I thought about how did I go about that? Just starting with general research on microaggressions and information about it. And as you said, I already had a base because I was teaching the topic. And one of the people that I drew from a great deal is Dr. Daryl Dwing Sue. He's a teaching professor at Columbia University in New York City. He's been a major contributor to the research for decades on microaggressions in general. And um, now the term microaggressions actually was started um, by this is in the module, so you'll have to read about it because I'm apologize, I don't remember the name. Um, but he really gets the credit for originating the term. And Dr. Sue picked up on that and researched the topic in some clever ways to learn about how they happen and how they can hurt people and what to do about them.
Mhm.
So then I had to focus on the medical and health fields because what I had been teaching had not been specific to that. It didn't exclude it, but I wanted my focus for the module course to be in that arena, and found a lot of good information and research. So uh, learned also how that information might be applied, and I found some excellent resources that are included.
So it's certainly a huge topic, microaggressions. So tell us a little bit about what's included in this section of the anti-racism module, which, by the way, is free. And there'll be a link on the description of this that you can access the module.
Yes, amazing that the grant provided this free resource. So the module or this section on microaggressions starts with definitions, and it includes examples that are specific to healthcare and medicine. Um, so examples of microaggressions, everyday kinds of occurrences that you'll recognize, or notice if you read that or learn about microaggressions. It helps sort of increase awareness. It also refers to the history of concepts by researchers and the consequences of microaggressions, the impacts that they have. There are not only immediate impacts, but also ripple effects in terms of poor patient care, a lot more health disparities. The list could go on, and it's very serious. And in healthcare and medicine, we're literally talking about life and death. at times. And it's not to say that microaggressions in other areas of life are not serious. They certainly are, and can also be life and death. But that's why one reason I think that learning about this in healthcare can really make a difference. So the section also talks about who does a microaggression and who's the target, how to recognize them, how to prevent it, and what to do if it happens. So we're not just sort of saying, don't do this, it's really very positive and trying to help people be the people that they want to be. Nobody wants to actually be hurtful or disrespectful for the most part. So then lastly, there's a scenario, and there are 8 videos in this section. They're short, but they're great. They take place in a hospital room, and Barbara, you can say more about how those are made, but they show various responses from patients and each person on the healthcare team in that particular incident. And it's really fascinating to hear the different viewpoints from each person. And then finally, there's a discussion question, and that invites people to reflect on the videos. We have resources, references, and then the module itself has student and faculty guides and pre-tests and post-tests. So an immense array of resources.
Mhm. Right. And those videos that you mentioned, that was actually based on a real life incident that had occurred, and they replicated it, role played, and then everyone who was in the situation then responded to it. And as you say, it's quite fascinating and very interesting and very useful too.
Yeah.
Did anything surprise you in particular about your research?
Well, I think I alluded to this before. I was surprised and really impressed at how well and how much medical and healthcare research has done in the world of diversity, equity, and inclusion. And again, how important health equity can be to patient outcomes and people's welfare. So it turns out that medicine and healthcare led the field in things like cultural humility. There was a researcher, Tervalan, and other folks who made that term meaningful and talked about what it was, and just sort of an approach to inclusion that everyone could embrace. Um, and I find working at VCU, we have a health sciences campus, we have a hospital system, and there have been requests dating way back from the beginning from healthcare before others were asking for programs, starting with implicit bias. And I think accreditation associations were realizing what a difference it would make if people were more aware of these topics. And so I appreciate the way that the efforts to make us better has really been led that way.
Mhm. Yes, definitely. How have you used the module?
Well, I use it for reference often. It's not only the sections that I wrote, but I benefit from reading the other sections and using that in thinking about different things or how I want to present them. Occasionally, I get the opportunity to teach from it, and I really enjoy that. I used it as a teaching tool at VCU when I presented a workshop with some colleagues about microaggressions. And that was for faculty in the health sciences campus. And we showed the videos early in the presentation and got a pretty immediate reaction from folks, actually. They said that the videos were very realistic, and they kind of got it right away. So
Realistic because it is based on real life examples. So that's
right, right.
realistic, yes. And then people later, unscripted, all the videos are unscripted, then talking about their reaction to a particular situation that had occurred. So you've touched on this, but I just wanted to ask you why you think the anti-racism module is important.
It's I think of it as a model for training. Um, People sometimes react to the word racism and race. That's been in our consciousness for hundreds of years, and so um, it sort of gets a bad rap, I guess. But anti-racism is and anti-any ism is trying to get rid of things that are harmful and hurtful to people. And to me, what could be more important? So um, the the thing is that um, this module could be about age inclusion. It could be about um, religion or anything that affects people's perceptions of each other and their assumptions and their stereotypes and how they interact. And so we need something to help us understand, learn more, and move forward.
Mhm, mhm. Is there anything that you'd like to add to our conversation here as we wrap up?
Yeah, I think I was thinking about the microaggressions section, which is now a few years ago that I wrote. And of course, we had to stick to a kind of a limit because it's a great big project. But I would say that there's no shame or blame in discussing these topics. And if the way that we teach and the way everyone I know teaches is really including people, helping people feel comfortable to come to the table, to learn about things, to learn about themselves. And we're all human beings. It's natural for the brain to generalize and categorize and stereotype. That's how we're wired. And people are also individuals. And so we need to learn to see the differences between people and then get along in ways that are respectful. So I think that's really the value of it.
Thank you so much, Jan, for spending time with us today, talking about this very important section of the anti-racism module on microaggressions.
You're welcome. It's always a pleasure to talk with you, Barbara.
Thank you. You've been listening to Jan Altman talking about the anti-racism module section that she wrote on microaggressions on our webcast, Improving Health Equity, Resources and Solutions. I'm Barbara Lewis. Thank you for listening.